Adult attention deficit can manifest in many different ways, but it is by now well recognized the fact that it stays in a way for somebody to do well in school or do well on a job or even do well with relationships. One of my patients came to me because he was doing fine on his job, but every time he would meet a new girl, inevitably by the second or third date they would break up because every girlfriend will say the same thing: "I'm so upset you're not listening to me." And he was very frustrated, and he knew that he was trying his best to listen. It's just that his mind gradually was moving away from what was the subject of discussion, and it was just moving away little by little by little. By the time he would bring it back, the discussion has moved on, and he would always be behind, and he would always give the impression that he's not listening, that he's absent, and doesn't care, when in fact he was deeply disappointed and he deeply cared about his relationships and his dates. Once we started addressing this problem, and once he understood that this is not his fault, this is not a negative trait of character that he had, it's not that he has a bad personality, it's not that he cannot form solid attachments, was just because his brain cannot focus well enough on a conversation. Once he realized that, first of all, the blame that he placed on himself tended to go away. Secondly, he was able to learn how to better cope with what happens when his mind tends to wanders, and then how to bring it back and how to mask that in conversation so people will still feel that he was present there all the time. And I'm happy to say that in about 2-3 months, he was able to meet somebody and to have a good, healthy relationship. And in 6 months, he got engaged, and a year later got married. It's very surprising how attention deficit can affect people in many different ways. And a lot of the time, people who are suffering from it cannot recognize it because there is this common belief that people with attention deficit are the ones who can't sit still, they just move around, they just are very hyper. But that is just one aspect of attention deficit, mostly the hyperactivity type. But the inattentive type are the students who in class never create any problems. They're quiet, they sit there and they're trying their best. It's just that their ability to concentrate and process information is diminished, and their grades suffer from that in school, and they hear a lot comments like, "You're lazy, you don't apply yourself, why can't you try harder?" And that always undermines their self-esteem and their ability to really perform at their true capacity. If these adults are discovered as children, then the treatment begins early on, and most of the time they are able to catch up, to make up for the deficit and be at the same level with their peers. And then in a sort of a equalizing situation, equal opportunity situation, they are able to do their best, and they are able to study and to get the true rewards for their work. If these adults are not discovered when they are children, they tend to constantly underperform, whether it's in school or on the job or in relationships. They always feel that they're falling short, and the fact is that they are, but it's no fault of their own. Their mental processes are not happening at the same speed and in the same way like their peers, and that's what makes them constantly fall behind and constantly feel that no matter how hard they work, they can never catch up, they can never really get the rewards that are proportional with the work that they invest in achieving something. The treatment for adult attention deficit is behavior modification, education into what the attention deficit is and how it manifests in that particular person, which can be very, very different from person to person. And also the medication treatment is very successful in helping these people deal better with the symptoms. We usually use stimulants like Adderall, Ritalin, Dexedrine, which are no different than the stimulants used for school-age children. It's just that as an adult, they will be able to tell me whether or not the medication works better, and we are able to adjust the doses a lot more refined way, because I have somebody who understands all these things and can tell me this is happening and it's good, this is happening and it's not good, I have headaches, I feel too hyper, in which case we go down on a dose, or it's not working well enough, in which case we bump it up a little bit. But one of the advantages of these medications is that they work immediately. A disadvantage is that they work only for a limited period of time. The immediate release Adderall or Ritalin works only for 4 hours. The extended release works usually for 7 or 8 hours. Gradually, people learn how to make the best use of this time, and they can take an immediate release medication, for example, when they have a very important meeting that requires focus and concentration, or if they have a 9-to-5 job that it requires concentration and attention to boring, repetitive activities 8 hours a day, then they take an extended release Adderall or Ritalin or Dexedrine, an extended release stimulant. It's a blessing and a nuisance at the same time, but again, with education and with every patient learning exactly for which purpose they can use the medication and which are the situations that gives them the most problems, and maximize the behavior modifications and changes with the help of the medication, usually the side effects are really minimal and the improvement is tremendous. I had a patient that was about to be eliminated from a law school program because her grades were not up to par. She was in a very competitive school. And when she came to me, she thought that she was dealing with anxiety and depression, when in fact, looking more carefully at what she does through the day and what her daily activities were and study habits were, we both realized that it was more than anxiety and depression. It was a matter of severe attention deficit that has never been diagnosed. And because she was so competitive, she was so frustrated for not putting in a lot of hours of studying but not getting any results, that her anxiety went up. So she has been treated for anxiety for years, when in fact, when we started treating the attention deficit and she understood how much of a drawback those symptoms were, the anxiety went away. Addressing the cause will improve the consequences. Addressing attention deficit will improve anxiety, not always, but a lot of the time that is the case. There are also situations when anxiety and attention deficit can coexist in the same person, in which case addressing them both at the same time, sometimes with medications but also with therapy at the same time, will improve both at the same rate.